guys, I want to show you a couple of reflexes on the hand that are particularly good for low back and hip area for helping with low back and hip pain or restricted motion. So the spine on the hand reflex is, if you bend the very top joint of the thumb, that is the cranium or the head. Immediately below that is the neck. That neck reflex extends down to the next joint. So this whole thing is a cervical vertebrae. The entire rest of it that follows along that first metatarsal, that first bone underneath the thumb, that whole rest of that is the rest of the spine. So it's a much smaller spine representation than on the foot. And I want to go for the low back or the lower spine. So I'm going to go back down to the base of the thumb. I can move that bone around and make sure that I'm on it. And when I'm at the base, I want to do the tiniest little caterpillar or rotation. And in order to find that, I have two methods that I usually use. I either have my webbing to webbing grip like this, where I'm pulling back on the palm of the hand to expose that, make it a little bit tighter in there for me to work, and then I come back towards myself. But the other way I tend to work is sometimes I will grip the thumb as if it's a handle and then use my thumb of the same hand to work down on the reflex. So both of these are low back areas. I'm guessing kind of tender based on what my client's face just did. And of course we know that she has lower back problems. So I can work on it this way, I can work on it this way. And another thing that I like to do to kind of bring some advanced techniques into it is I actually like to work around that entire bone, not just on the palmar aspect of it that you can see from the palm side or that you can feel from the palm side, but I actually like to work around that lower part of the bone all the way around the thumb, including on the opposite side. So this would all still be low back, low spine, and I can work all along there. There is a chronic pain point that happens to be just below the webbing between the thumb and the index finger, and so you can press into that chronic pain point. It's also one of the Chinese points. It's called the happy point because it does a lot of things. So for indigestion, for motion sickness or travel sickness, but it's also a pain point to help relieve pain. Usually that's also kind of painful. It's a little tender as a point, but it helps with body pain. Helps to relieve it, so it's a good one to hold. And you can hold that for 30 seconds, even up to a minute. And of course, all the time, you're working with your client and cooperating with your client with how much pressure they can tolerate. But it is good to have a nice firm grip on that one, and then it has an effect on the body, much like if you had taken a Tylenol. So the hip reflex for the hand, there's a couple of them. The whole groin area and hip area all around the wrist, but the actual hip area that kind of is a similar hip area to the one that's below the fifth metatarsal on the feet is actually tucked along the fifth metacarpal of the hand. So I find that metacarpal, I find it from the outside of the hand, and then I go right to the base of it. I'm still on the metacarpal. I haven't fallen off the metacarpal, and I'm not in the actual wrist joint itself. I'm up on that bone of the hand, but at the base of it. And here's what I will press in for the hip reflex. So that's one of the hip reflexes. And I'm just pressing, I'm doing a pressure glide along here. I could do a sustained hold. And what I want to make sure with my grip on the hand is I'm not squishing anything with my grip hand. So my grip hand is making sure the thumb is separated from the rest of the hand, that it's a comfortable kind of grip, that I'm not poking anywhere else. Your grip is as important as your working finger or your working hand. And then I'll just kind of do a little bit more of a pressure glide or a rotation in through here. So that's the hip that I'll work on along with the low back. We can add in some pain relieving points. And then if you wanted to add in some anti-inflammatory points, if there was any kind of itis or inflammation along with any kind of hip or back condition, then you could add in any of all the channels from the webbing all the way down between all the long bones would be all of the lymph channels, including between the thumb and the index finger. Hope that helps.